commonly in that big toe,
Right.
it really can deposit in any joint in your body. Hey guys, Dr. Hurlis here. We're gonna remove some gouty tophi for our patient here who's had this for a little while, causing them a lot of pain. So we're gonna try to help them out. All right, so we'll test it out first. The pressure, like I said, is not gonna go away, but if it feels sharp, tell me. Get this blade on
I really don't even feel a lot of pressure, to be honest.
there. Didn't feel that with the tourniquet?
I did feel it, but not extreme.
Okay, all right. I'm gonna test it first, okay? So I'm gonna test it with something sharp here. You feel that at all?
No.
Okay, good. All right.
So is a lot of that liquidy?
It sometimes is liquidy, but yours is probably, honestly, a little bit more cottage cheesy.
Really?
So, yep. And you okay?
Yeah.
Okay, you move for a second. Just want to make sure.
No.
Gout is caused by elevated uric acid. Do you know what that is?
Well, I do, but I don't really know how. Nobody's ever told me how I need to control it.
Okay. Well, there are certain foods that are high in what's called purines. And purines are like a substance that's in food that can cause breakdown into uric acid in your bloodstream. And when you either can't get rid of it or your body produces too much of it, it deposits into your joints, or it can. And so controlling it by diet is probably the most important things. So things that are high in purines are like red meats, red wine, which I don't know if you do that, beer, lots of other things, but we usually recommend patients go on something called a gout diet so that it can kind of stay at bay.
Right.
So and we can give you information on that as well, because that will help from this coming back. Do you want to see this?
No,
Okay.
I'm fine.
All right.
My phone, believe it or not, I have a Bluetooth cell phone here. And
Yeah.
it was in these ears, and I was trying to listen to you, and this thing was going off at the same time. I thought I had it turned off, but evidently I didn't.
No worries. All right, so we're going to get this all out of there for you.
I'm really glad to be getting it out, I swear.
Yeah, we'll try to get most of it out of there. It's not liquidy anymore. It's more of that crystallized tophi. So it can become destructive to your joints after a while. Luckily, I really don't think yours has extended down to your joint space.
It's just wild how it gets in there like that.
It is, yeah, it's crazy. And it's a lot more common than what people think. And also commonly misdiagnosed, like you saw, you know?
Yes. I mean, they just kept telling me arthritis. I'm like, oh my God, that is so huge. Can't you do something with it?
I don't think with the way this looks, this isn't really arthritis too much.
That's what I thought too.
Yeah.
How could they tell me that?
It could be mistaken, I guess. Yeah.
Yes, I guess. It's grown like twice the size.
I was going to say maybe it was a lot smaller the first time they saw it.
It's still pretty good size.
Yeah. Yeah.
And I'm not so sure it's not coming up in the toe beside it.
It doesn't look like it right now, but we'll keep a close eye on it to make sure it doesn't.
Right. Yeah, I don't even feel that. That just feels rubbery when you pull it.
Good. I don't want you to feel it.
Yeah, I don't feel it.
Good, good. We're getting a lot of this out of here. So you can see as we get down and getting this white stuff out, there's nice healthy tissue underneath of that, which is good. So it's really not down to your joint. It's just in the layer above it, which is good news for you.
That's good. So will it come back if I don't take care of it myself?
It can. Yep. Gout can definitely come back in other joints or even in this joint if we don't get it controlled. So we'll definitely work on that with you. Okay. Other things you can take, like we talked about long-term medication, still probably don't need to put you on that if we can work on it with diet. Yeah. But you can take tart cherry juice or tart cherry juice capsules. And those help to control it too. It's more of a kind of a natural remedy for it. But like I said, we'll get your uric acid today, that level in your blood, and then kind of see what that is and go from there, okay? We're glad you came in today.
Well, I'm glad you're not scared to touch it.
We're not scared of much.
Yeah.
Just mice, that's about it.
Yeah.
Almost done here.
Are you going to be able to get it all, you think?
I think so, yeah. I'm seeing some really good healthy tissue underneath of it. So I'm hopeful that and this should alleviate a lot of your pain. It'll probably be a bit sore after this, just because we did do quite a bit of work on it.
Yeah.
But then afterwards, just taking some Tylenol, you'll probably be okay.
Yeah. Well, I'll deal with the pain a little bit.
That's right.
I hate pain medicine anyway.
Do ya?
Oh my God, I've had so many surgeries.
Yeah.
I've had a colon resection because I had colon cancer.
Huh.
And, oh my God, they cut me from up here all the way down, and I'm like, they try to give me those pain pills to take off.
Yeah.
They make you definitely sick.
I hear that from a lot of people.
Oh my God, I cannot. It's like, oh, do you want to be deathly sick or just have a little pain?
Yeah. Goodness.
So, how these people get hooked on these pain pills, I'll never know.
Because you're like, I don't want to take that stuff.
Oh my God, no. It's terrible.
This is getting to be, so how we can tell when this is kind of done is you can see the difference in this white tophi here, this chalky substance, versus the nice clean tissue on the sides. So, and we do have a little tourniquet on your toe, that way it's not bleeding, so don't be alarmed because it will bleed. So the dressing that I'm putting on it today, actually, if you can, I'd prefer you to leave that on till I see you back.
I will, I won't take it on.
Okay. And not getting it wet in the shower.
Right. Yeah, that's the weirdest looking toe that I've seen. I'm telling you, I've never seen nothing like that.
Yeah, you're getting like a toe makeover here, I think. It's going to be a lot smaller when we're done.
I hope so.
Gout is one of the most interesting things because even though it's not common, like I said, in these small toes, it starts more commonly in that big toe.
Right.
It really can deposit in any joint in your body. And so, yeah, that's why we got to make sure we kind of check over all of your foot joints like we did before.
Well,
Sorry, Belle.
When it really hit me that time, I couldn't walk on it at all, hardly.
Really?
Oh no, I was hobbling, and I'm like, oh my God, this toe is killing me.
Yeah.
And it already had some little growth on it, so maybe I had gout and just didn't realize it.
Probably.
Yeah.
It had some even before this recent time, you're saying?
Yes.
Yeah. Well, you poor thing. This toe had to be pretty painful then.
Yeah. Yeah, we were out camping and that toe started, and I'm like, oh my God, hell, I can't even walk hardly.
I think there's some more over here.
And forgot about it.
There's some more coming out. All right. Kind of comes from all sides of your joints here.
It does look like cottage cheese.
It does. It's interesting.
So y'all put this on YouTube for people.
We do, because it's good for education, because just like you said, a lot of people don't know what gout is or what causes it, and it can be caused too by like if your kidneys aren't functioning the way they should, and so it's an indication that we should check your kidney function as well, to make sure, you know, that's not the reason for it. So you doing okay still?
Yeah.
Not getting squeamish at all?
No.
All right. We got all that out of there. And we're just suturing it closed here. About 2 weeks and this will be healed right up.
Well, I didn't have any trouble with my colon surgery, or I've had hernia surgery too from the colon.
Okay.
So I had to have surgery twice.
Good. I mean, not good, but good that you had no trouble healing.
No issues at all.
Yeah.
I mean, hell, and that's a big incision.
Right.
So this should be done.
Yeah, this is a little bit smaller.
Yeah, thank God.
And you can see that we're doing what's called a horizontal mattress suture type pattern right here, which turns out the skin edges. That's right. And you've had the suture, but so you know, but that way the skin can heal properly and it will lay down eventually. But we're just making sure those edges don't get rolled under and have a trouble healing. There's a lot more gout in there than I thought there would be.
Well, I'm sure glad you got it out.
Yeah.
I hope you got it all.
It looks like it did. It was a nice clean pink base when we're done. So that should help you a lot.
Is there anything you guys do for arthritis? Like I have arthritis in this one from where I had both bones broke.
Oh, in your ankle?
Yeah.
Yeah, there's lots of things we can do. Bracing, depending on it. We can do injections, we can do orthotics, that kind of stuff that will help.
I've had
So-
injections and they only last like days to like 2 weeks max.
Oh, really?
Yeah.
Well, next time you come, we'll get an x-ray of it and kind of see what we might want to do, okay?
Sure.
So then we look to make sure the blood flow returns to it, and you can see how the toe's pinking
Right,
up there.
right.
So it looks nice.
Yeah.
So we're going to put a dressing on this, and you'll be good to go. But make sure you guys like our channel, follow us on YouTube for lots of informational videos.